Welcome, Steve Olivares here, CEO of Pinnacle Allergy, and your host of Beyond the Shot podcast, where we interview innovators, influencers, and income drivers in healthcare, those that are transforming care, scaling practices, and driving exponential growth. Today, we have the pleasure of speaking with Dr. David Lee Scott Jr. He's the CEO and president of IVQ Nexus, DLS Research and Ventures, as well as ClinLGX Laboratories. So, welcome, Dr. Scott. I'm excited to have you on the show.
Thanks for having me, Steve. Look forward to chatting with you for a moment.
You're welcome, sir. And, we were inspired by ClinLGX vision to digitally transform healthcare, placing patients truly at the center of the ecosystem. So, Dr. Scott, tell us a little about the story about ClinLGX, DSL, as well as IQV Nexus.
Okay. Once again, thanks for having me on the podcast. Those three companies, they represent different phases in what I thought was necessary to provide those in healthcare and those needing healthcare with optimal opportunities to get on a great path for wellness. Um, DLS Research and Ventures was a misnomer. I obviously stand for David Lee Scott. I created that company with the fun of doing research and being innovative. And when we went to fill out our CLIA license for the clinical laboratory aspect of what we do, we put that company name on it, had no intentions of doing that. We had a great name for the lab, which was Professional Diagnostic Solutions, but DLS Research and Ventures, which was my think tank, got put on the paperwork, and we rode with it ever since 2016. With that, when COVID hit, when we had to change the shift of what we were doing, mainly in the allergy and infectious disease space, there was no one interested in getting allergy or the common cold testing. They wanted to know if they had COVID. So we shifted gears a little bit there. And during that period, during that phase, when the whole country had to adapt to the way they were doing things, we started to get more into understanding logistics, specimen tracking, understanding how to do things in a contactless manner, understanding how to innovate and integrate machine learning, next generation computing, and AI technology to actually do the things that were daily tasks that we probably couldn't get to the lab to do, or people were in shelter and we just couldn't do it. So all of these little thoughts and things that I had created, technically speaking, they were the progenitors for ClinLGX. ClinLGX is a company that focuses on developing tools to assist with the clinician. In this particular case, it allowed us to develop applications where even if a patient was coming to get COVID testing, they could register ahead. We can get all the information in the system. We can tie that information using HL7 and other technologies in the healthcare space to get all the information. So all you do is come by, get a finger prick if we were doing an antibody test, or get a swab. And we did all that, managed that. We alerted the people when they were there. We alerted when they got there. So that's what ClinLGX was on, just providing the patient with a comfortable user experience during a time when people were afraid. They wanted to get tested. They wanted to know where they stood, but they didn't want the normal rigor of going to the doctor, going through the whole process. And IQV Nexus, it's less than a year old, but it became the management, Nexus being the brainchild of everything that we do. And also, I've always been told that I was not the person. If you wanted a job with me, I would hire you. And my colleagues, they would be more. I believe in giving everybody a chance. And so, IQV Nexus became the brainchild of me managing all my other entities that relate to healthcare. And that's how we started to develop electronic health record software, a list system, and revenue management software. So those things all came, like everything else in my life, came by chance. A guy that likes to hang out in the lab. So trying to put them all together.
Awesome. Well, thanks for sharing that. So your platform really empowers clinicians to predict and differentiate between food allergies, food intolerances, obviously environmental allergies, or airborne allergies as well. Issues in the gut microbiome. What made the clinical confusion such a problem worth solving?
Growing up in Mobile, Alabama, um, never heard of the word allergy too much, or it was used incorrectly. Okay, if you had a tummy ache, you were allergic. If you ate something that didn't agree with you, you were allergic. It never really got down to the type 1 hypersensitivities, the fast acting response you get with IgE, the itching, the scratching, the sneezing. It was just no matter what it was. Hell, if you missed a jump shot, you were allergic, you know. Uh, but lo and behold, especially in the space of food allergies, there's a big difference. You can actually dissect that into three areas: allergy, intolerance, and chronic disease. And many of the symptoms overlap. However, you need to be able to differentiate and identify which state we're in for the appropriate treatment. Um, Intolerance, you're probably going to need some Tums or some milk magnesia from back when I was growing up. If you need allergy, you're going to need an antihistamine. If it's a chronic disease, you're going to need to see a specialist to help you manage that. So the protocols for care are different. The treatment protocols are different. So you need to be able to identify that. And again, in many instances, the symptoms will overlap. If I may, celiac disease, gluten. You can have non-celiac disease, gluten allergy. You could have gluten intolerance where your GI system doesn't like gluten. Or if you have some gluten, you would probably have some type of dermatological issue. Three different things. So you need to be able to differentiate which space they're in so you can attack aggressively provide the patient with a route to wellness without wasting time and being sensitive to, you know, income. So that's how we need to be able to differentiate those things to test. If you have gluten sensitivity, that's one set of testing you may have to do downstream. Celiac disease, you probably can do some biopsy, some GI testing. And if it's allergy, you're gonna have to do that the famous skin prick test, or you're going to have to do some in vitro IgE testing just to differentiate what you're doing. You know,
Gotcha.
treatment protocols is a must to know the difference.
Absolutely. So you built the system where doctors and patients can make shared decisions in actual real time, efficient. So how has physician patient dynamics changed in your view, and how does all of your platforms streamline it?
Imagine this, Stephen. If you could, a patient can walk in the office, the clinician already knows or has a pre-planned approach, what test to order, you know, and if they're already far along in the disease state, what medications to offer, uh, how does this present set of symptoms present themselves, and how do they affect the brain gut nexus? All these different things. Notice nexus, IQV nexus. That's what it's about. Intelligent quotient
Mm-hmm.
nexus. Um, just many times, I have many friends that are in the sales side of healthcare, and I have friends that are in the laboratory side. The biggest issue they complain about is doctors are rude. Doctors don't have time. None of those things are really true. They just don't have time. Especially a guy like you with your personality, you'd be a great, clinician, and you have probably a line outside the door. People I want to get treated by, Dr. Steven. You
Yeah.
know, so that's only 24 hours in a day.
Right.
One person. So if all those things could be at the palm of his hand, all you got to do is take a glimpse. Okay, this is what I need to do. His medical assistants, nurse practitioners, everybody knowing what to do. It's like running a play on the football field.
Right.
Everybody knows what their roles are, and it speed things up. So I'm trying to build systems that support, try to dispel this notion that doctors are arrogant or they don't have time. They're just busy, you know. But the key to that is making the approach more patient centric. but the patient can assist you in helping them along the way, you know. And that's what are you allergic clinical decision to. There's two versions of that: the patient version, where the patient can go online and enter the information, as well as the doctor and his inmates in his office just can input the information to give you some downstream advice.
Hmm.
The clinical decision tool is not a standalone remedy. It has to have the support, and the decision still lies in the hands of the clinician or the healthcare provider. Um, okay.
Excellent. So, what was that aha breakthrough moment that you had that you knew you had a clear impact on patient outcomes and workflows?
Dear friend who's in the entertainment industry, daughter was actually having some type 1 hypersensitivities. For those that don't know, type 1 hypersensitivity is just another big way of saying IgE, an allergy. Uh, and we jumped down with the tool. I sent the tool to him, and he input all his symptoms, and within minutes, it kicked out the results. Then mom still took baby to the doctor, and the doctor spit back to her, shared with her everything that the tool had already told us. And
Ah,
so when you got someone who, when a mom is trying to take care of her little cub,
yeah,
all she wants to know is remedy. She ain't got time for arguing, all of this stuff. She wants a solution. So in that particular instance, the solution was presented. And that was that eureka. That was my second eureka moment. When I got ready to graduate from Georgia Tech, I was doing some bacterial work, and we had some stringent conditions for the bacteria to grow in. And I looked at the tubes one night and picked the tube that was going to grow the bacteria strain we were looking for. That was my first eureka moment, and that's the one that catapulted my career to want to stay in the lab all day. You know,
gotcha. Oh, that's awesome. Love the passion that you're exuding and your um, your thoroughness of really breaking down barriers and keeping it simple at the
got
end of the day.
got to, got to.
Absolutely. So looking forward, what keeps you at night? What's some of the biggest challenges or opportunities that you're trying to tackle now?
What keeps me up at? I'm a Star Trek fan. Okay, I'm a Trekkie. Okay, uh, I don't want to be rolled over into the realm of being a con. Okay, not a snake oil salesman.
Hmm.
However, I stay up at night. What type of Jedi mind trick can I pull on these clinicians? Because our biggest challenge, as you know, is adaptability.
Yes.
Trying to find ways. A lot. My mother used to always say, "You can take a horse to water, but you can't make him drink." And trying to get the clinicians to see where this is valuable. And I think it's important that you're not intrusive,
Hmm.
not disruptive, and you have to sit back and take that extra moment to find out how can you integrate yourself within that clinician's workflow. That be if they're still using faxes to send over requisitions, or if they're using the latest in technology, whatever it is, you as the provider of a solution have to provide that in a way where that clinician is comfortable. That's what keeps me up at night. And the first time something goes wrong, they're going to run away from it. So
Hmm.
I have my staff tear up our instruments, tear up our tools, tear them up, because somebody's out there going to tear them up, and we're
Oh,
going to try to have a list of answers, and we want to be able to cut off the issues or provide a quick solution so we can build confidence in clinicians. But the opposite word, what keeps me up is ways. The biggest challenge is finding adaptability, because those guys need income.
yeah. Hmm.
They got to protect their reputation.
Right.
They're humans just like the rest of us.
Right.
So we've got to have ways to assist them without causing issues within their daily workflow. If
Right.
Dr. A walks right every time, I need to be my tools need to be sitting there somewhere to the right, waiting on him, and just hand it off to him. Pass the baton.
Right.
That's
Absolutely.
what.
I mean, I've read these stats. I think it's 70, 80% of all clinical decision making is made by a diagnostic tool. So,
Yes.
and it's important that physicians trust that diagnostic tool first and foremost because it impacts their clinical decision making. It also impacts the medication that the patients might need based on that clinical decision tool. So they need to trust the results. They need to trust the lab. They need to trust the process, and making something that is adaptable to them.
Yes.
They can they can follow all that downstream is highly important. So let's take a little focus now on actual like disease states that you're focusing on. So, in the U.S., about 10% of the adult population believe they have food allergies, while many causes are actually, as we know, intolerances. So, how does this confusion impact care, and how does your technology, and more importantly, address it?
As I stated to you earlier, I grew up in an environment. It wasn't ignorance. It was just we didn't know. Uh, I never heard of when I'm 10, 11 years old. I never heard of IgE. My dad may have because he was a biologist, um, but and my mother should have because she's in the culinary sciences. So, but they just sit around with us. Hey, Junior, come on, let me tell you the difference between when you ate, that asparagus versus. I'm gonna say I don't like it, but
Right.
the confusion is. I was talking to a clinician the other day, a guy in healthcare, and he does allergy testing, and the patient was exhibiting GI symptoms as well as some dermatological issues. Uh, and his IgE, the skin prick test, and everything came back negative. And I said, "What do you do after that?" He said, "Nothing."
Yeah. A lot of times that's the case.
Yes, but nothing didn't solve that person's, you know, physical ailments that they're experiencing at that moment. So
Hmm.
we, our systems will score based upon the timing of an event, adverse event. I like to use the word adverse reactions. That's all encompassing. This makes sense. You go back and you look and you hear people talking about allergy, intolerances, food
Right.
sensitivities. Well, what all these things mean? All these different things mean different things to different clinicians. So you may have different protocols for care when that happens. And the confusions comes in, which is the right way, which is the wrong way. What my systems will do, it'll give you some choices, some leadway. It'll tell you, hey, as an example of the gluten, it'll tell you, hey, this seems more like an intolerance versus an allergy. I recommend you do this line of testings to figure that out. And more importantly, it's also going to give you all the cross reactivities because gluten is found in wheat and other grains. So
Hmm.
it'll start to give, if you take that extra 1 minute as a clinician or an assistant and you start to read, it'll start to give you, it's like being a forensic scientist, only
Yeah.
on the diagnostic side. And it'll start to eliminate that. And you get on stuff quickly. Doctors usually, what's that? What, 10 to 30 minutes? 30 minutes is stretching it. Doctors don't have 30 minutes to see one patient.
I would say more 5 to 10.
Five, just trying to be politically correct here.
Yeah.
Uh, but you need something that's going to give you that answer quickly.
Right.
Okay. And what better way to get some ideas, especially when you got a patient load of 40 patients for the day. Everybody you want to give them this tool will help you make that patient feel like they're the most important thing on the earth. And that's the goal. We have some answers. And if the clinician is savvy enough, let the patient, when they're pre-registered to come in for a visit, go ahead and fill out the tool on their end. Now you're
Hmm.
on when they hit the door. You already got them ready to go. Boom, 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 boom. You know, uh, and just understand, especially in the primary and general practitioner realm, understanding these different diseases in these situations, and not PDRing them. Physicians desk reference. Just give them what they need. And the tool will help you delineate that. Uh, I hope I answered the question. I don't want to get too excited.
Yeah, no, no, you did, you did. So tell me a little bit about the tool and how does building trust and traceability change how clinicians and labs collaborate?
Extremely hard. Everyone has their silver bullet proprietary formula, you know, uh, how they operate. I tell people all the time, me and my wife have been able to survive together for over 30 some years as a couple, and we're totally polar opposites. Uh, but we love each other, okay? We could be in a room and we both could sit up and look and laugh. We could be laughing at you, Steve. You wouldn't know it, but there's a connection there. That's that trust, right? We're building up each other's telepathy. So we try to put things in place to build upon the telepathy and allow it to learn with that particular clinician. You know, uh, many times you can see trends in a practice with ICD-10 codes they use.
Mm-hmm.
You can always see their treatment decisions following a certain pathway. Their testing choices are the same. No, we want to be able to give what the tool will do is it'll give you the opportunity to think. And then it also gives you predictions along with the allergic reaction. It also is going to give you some GI information too. And
Mm-hmm.
more times than not, allergy in the traditional sense, type 1 hypersensitivity, if you consider the 4 or 5 different hypersensitivities, has nothing to do with GI. You don't typically see the runny nose related to something that comes from a GI issue. But then if you flip that around with certain foods like onions, I hate onions. Uh, they get me in every form and fashion. They get me the nasal, they get me the GI. It's just like in my life, it's the creme de la creme of torture, you know. And I had to sit here and use my own tool to figure out. And it came out I was saliates is what was my problem. A compound found in onions. My
Mm-hmm.
tool helped me discern that. Same way, you know. But it also speeds up what happens in the practice because it's going to also kick out the ICD-10 codes. It's actually going to fill out that CMS 1500 for you. It's going to do all those things for you at one time. All this stuff happens in like milliseconds.
That'll say.
But we give
Excellent.
you 15 minutes because of the traffic. We'll say 15 minutes,
Right.
but it's much faster than that.
Okay. And we're in an age now where technology, man, is coming fast, and let's just use AI as an example. We're on Chat GPT 5, so you can see how fast it's actually learning, but it still makes mistakes.
Mm-hmm.
Obviously. So there's still a little bit of lack of trust.
Mm-hmm.
There, I saw where a gentleman now was hospitalized because he used Chat GPT to change his diet, and they told him to do something, and now it caused him to go in the hospital. So, how does your platform avoid some of those pitfalls that technology can get us into?
First of all, I think Chat GPT is an excellent tool when used appropriately. Maybe there should be some federal, some regulation there that says don't try this at home. Uh, Something, you know. Um, I come across people every day. Well, what makes your tool different from Chat GPT? On many issues. If you go back to a disease that was just found within the last year, Chat GPT is not going to have it. Because remember, that's still a human somewhere entering this data. So what
Right.
I did on average with the chat version that I use, I couldn't get good information that was 2 years old or less. We did these studies. Um, that's not down in the product, but that's where we saw a glitch. And we're not trying to answer our questions. We're basing all of our answers off clinical decision tool trees.
Mm-hmm.
Our algorithms are based off of decision trees, based upon information developed in health organizations, white papers, clinical studies, and just traditional data mining. Man, the first time I tried to throw data into uh, a machine learning application to try to identify trends when it came to the allergy space, it didn't work because there's so much overlap in disease. You know, uh, like for instance, this person you just said was hospitalized. They probably got an answer, but it probably wasn't for their true disease state, because there's so many other things that go along with it. Your patient history. So it really has to be a nexus of information. You got to pull your medical records in. You got to pull in your symptoms. You got to pull in where you are in the world, especially if it's an environmental allergen. You got to know where you are in the world. Then you got to
Hmm.
understand that I just ate a piece of fruit, and then I'm starting to get symptoms like when I was out in the woods with the grass and the pollen. I got an oral allergy. It's not going to do all that. It's not going to tell you what the truth. And another feature is it's going to give you, which I think is pretty neat, over the counter treatment protocols, prescription level protocol, and natural, and herbs and supplements. It'll give you all three of those, um, so you can start to treat yourself. But most important thing is going to tell you, call your doctor. And if this is an emergency, don't call, are you allergic? Call 911.
911.
you
Very
know.
important disclaimer. Very important disclaimer. So,
Yes, yes. I
uh,
hope
awesome.
question.
Yeah. So let me ask you this, from a business perspective, what partnerships or hospital system or academic networks, insert tech here, are most strategic for you?
Share a little blurb from a technician. When I first started working on Are You Allergic? And I had plenty of time because I'm a diabetic, and I was stuck in the house. And I had a surgery um, to correct some things, and I just stuck at home. And this was all on the tail end of COVID, so I had plenty of time to sit where I'm sitting right now.
Hmm.
Uh, my wife would bring me dinner here. I'll just sit here all day. And one of my Muhammad D.A. from the synagogue, he said, Dr. Scott, well, what this thing is doing, at least for our laboratory, I'm not going to have a job. That's that third eureka moment. Because he was saying that everything that he needed to do, other than the physical aspects of it, right? I had built systems, built off my tools to do it. You upload data. Somebody, the system come and grab that data. It makes a report. It does the QC for you. It does everything for you. Then it tells you what you need. Oh, by the way, you're out of this reagent over here. You need to update that. So it really helps deliver. So what I found out, the type of partners I need were data scientists, not clinicians, but data scientists. So once and I call them bots. I got my minions, bots, whatever, get the data scientists in. They can input the data, build the things around particular tasks and triggers. And then you let the clinicians manage the output from those. But the key to that is letting a clinician walk through a process and how he would have done it, and then see what we would have done. Then on top of that, start to collaborate with people, different pieces of the industry, a coder, a biller, the nurses. We still got to have phlebotomists. We still got to have special collectors. But then you got, you know, partners like our roadie, logistics. Until I got into COVID, I never even heard of Delta Dash. So the major partners that I've partnered with is people into data management and logistics. And like, what does that have to do with healthcare? Got to get a specimen. Got to get them a treatment protocol. Now we can do all this from the comfort of our homes, with always this very, very, get those positive endorphins going when you can be at home trying to heal yourself and go through whatever you're going through. So it's not just one set of parts. It's just a plug and play. You know, uh, Understand if I want to talk to a hospital, I got to be able to make sure I got the proper HL7 gear to plug into their systems, and you know make it where they can cross talk. Academic systems, I got to change the way I talk, not my diction, but just my approach, um, and just understand what those companies have going on, and then come up with these strategic partnerships based upon mainly data, logistics, and healthcare. In the clinical part of it, I think we got that down pat. We have number of the partners are the clinicians,
Right.
you know, um, but those other pieces are, and having someone who can rewrite the way I talk, so it would be more palatable for a non-scientific person. You got to have clinical writers. You got to have uh, a technician that's not afraid to be a jack of all trades. As my systems develop, my technician's role has to be smarter than the system. So a special type of person.
Gotcha.
Okay.
So, medical practice for the last 16 years have hired us predominantly do several things for them. Increase access to care.
Mm-hmm.
There's obviously a decline in allergists across the United States is happening since as back as 2010. So the last 15 years, they've steadily been declining. While the number of patients with allergic diseases, whether it's allergic rhinitis, food, or eczema, has been increasing. 1 out of 3 adults, according to CDC in 2021, 1 out of 4 children now suffer from one or more allergic disorders. So my company comes in and helps these providers increase access to care to those patients. That access to care directly can improve a patient outcome. And also, we know that over the last several years, and when you take inflation into the mix, that physician reimbursement is actually flat or actually even declining. So it's necessary for them to find revenue streams that are not physician dependent, that actually can seamlessly integrate into their systems, so they can continue to have a profit at the end of the day. So how does partnering with you help physicians with some of those pain points?
Well, first, I can't help everybody. Uh, and what I mean by that goes back to early in the conversation we talked about trust and adaptability. And when you got when your healthcare is trying to keep its doors open because of the financial impact of all the plethora of things you just, aforementioned about declining reimbursement rates, according to where your practice is, can your patient base keep your doors open? Uh, it goes back to what keeps me up at night, trying to figure out ways to partner with the clinician so that we can show him how these tools. I showed a clinician where he could save, oh wow, I think it was like $71,000 a year. It went over his head because we were able to eliminate. We're not trying to do this. Repurpose people. Don't terminate them.
Right.
Repurpose. Okay, but we were showing where he was wasting money, and all this stuff could be done, quickly with our systems. And our first approach of our entire system, which is called front desk, um, we were taking the Athena Health model. You're paying per click.
Mm-hmm.
You don't have that many clicks, but you're still paying $35,000. That's a waste of your investment. You know, repurpose that person. You know, they don't want to do it, whether it's a family member or someone they're loyal to, but you still are having financial challenges. So up all night trying to figure out ways how to integrate in there to show how the tools can be impactful.
Gotcha.
That's the trust. So
Okay.
you end up having to give demonstrations
Did it.
over and over.
So, what would be your core message to innovators, physicians, any practice leaders looking to blend tech with care? And you might kind of answer that a little bit, probably your prior answer, but what would be your message to them?
It's never too late to teach an old dog a new trick. You got to get some meaningful CME credits. You've got to study. You got to stay on top of the latest trends. Then you go back and try to find those things that you're comfortable with, right? Or someone is in your office that you trust is comfortable with, and start to try to, on a Saturday when nobody's at your office, if you're not open, practice some of these things. Go through some mock circumstances. What happens here? You have to be an outlier. You got to be comfortable enough. I try stuff all the time. I might not tell the next person because I probably screwed it up a million times. But the million and one time when it gets right, then I introduce it into whatever I'm doing at that moment. We got to be more comfortable. But it's hard, Stephen, for them to do that when they're trying to generate income to keep the doors open. I keep saying that, you know, that, but that also impedes them even from being innovative to be creative and financially, because we're just caught and they just do these things over and over again, and just got to slow down and give things a try sometime.
I got you. All right,
Yeah,
that's great advice. I mean, are there any upcoming partnerships or pilots with any of your ventures that you like to share?
absolutely. We have a great product that's coming down the pipeline. It's called Are You Allergic Household, where we've developed a biomonitoring system. And the biomonitoring system is the human being in that house. And we have a lot of little nifty tricks and bells that can give rise to why is your house making you sick?
Uh, are you allergic to your house? I love it.
And it may not even be, it could be an intolerance, but identifying the causative agents within your dwelling.
Mm,
Uh, and we have some pointed targets that gives a lot of information. And there's also some inflammation markers associated with that, CRP, some of that kind of stuff that can give you an indication of what's really happening to you. And we check, go on vacation and see what your levels look like, look what your exposures come back when you come, that kind of stuff. It's pretty neat. I'm really proud of that product because it segues and it runs straight with our front desk manager, and we have a beautiful product that's also coming called My Front Desk Connection, where the patient can put all of their information in an immutable format of blockchain technology,
hmm
where they can actually invite clinicians of their choice, especially if they're PPO, where they can send information out on themselves and share information and get a personal nexus with their clinician and get treatment plans and start working. It actually promote what's going on in telehealth market. Similar to, I like this product before I got into Solve, the company Solve, SOLV, with their telehealth pro, similar to that, but we just got so much more, because we truly have a lab, we truly have revenue management systems, and we truly have, it's one-stop shop. Did you ever see, if I may digress for a moment,
hmm
I love Steve Jobs, okay?
Yeah.
2007, January, whatever date in 2007, Steve Jobs introduced the iPhone for the first time. He said, an iPod, a telephone, the internet. I forget the third thing, but in the marketing world, everybody teach you about threes, right?
Yep.
Say threes. He kept saying it over and over again, and it just made me levitate. And I said, okay, front desk manager, an EHR system, laboratory information system, and a revenue management. All boom. You can actually see a patient's GUID, which is a 16 to 20 uh, long set of digits. You can watch it go through all those things, like your heartbeat. I was like, man, sorry for geeking out, but that's,
No, no, I love it. That's
yeah,
awesome. I love it.
that those are the products that we see in front. So, my household and my front desk connection, which also allows you can put all your bills there, get you a billing plan. Also, we have a team that can come in once they have that information and negotiate your bill. So you're only paying one thing a month, and that system will help you do that. And
Okay.
we don't want to touch your finances. We just want to show you what's there and let you do a better job. A lot of educational pieces there too.
Awesome. Love it. Look forward to hear more about that.
Hmm?
Let us know when it's ready for the marketplace. So, in closing here, if you could just draw any leadership lessons from any unexpected source, whether it's sports, whether it's arts, whether it's academia, what would that be?
Strong decisions aligned with adaptability, because that decision you may make send you to a fork in the road. but you got to be on the fly, adaptable to make that change and still be resilient and go for it. While at the same time being a visionary and thinking outside the box. That sounds like a whole lot of cliches, mumbo jumbo, but that's what I live. That's my mantra I live by. I got to do it that way. You can call me in the morning and say, "Hey, Dave, I want to do X." I'm not going to say impossible. I'm going to come back and tell you now that route is impossible, but here's how we can get there. Okay. I love providing solutions and options. And I think if you look at some of our greatest entrepreneurs or leaders, whether it be uh, Bezos, I love the Bezos story. I love how Jobs really was set out to burn in the pasture, and the rebirth was amazing.
Mm-hmm.
You know, um, I've always admired Barack Obama for his cool head look approach. And in closing on that, I've always wanted these glasses that Steve and Olivares wear. But yeah, you can't pigeonhole leadership into one. Those are more traits and great character.
Mm-hmm.
But my dad used to always say to me, um, exposure, critiquing, all those things actually expose your character. Criticism, comment, you know. So when he would come in, Winfred Harris was the president of Clark College before it became Clark Atlanta Thomas Cole took over. My fraternity brothers, they all Alpha Phi Alphas. I stayed in the lab one day, Stephen, for almost 19 hours. He told me I hadn't done nothing. I was hurt. I had wanted the places to pile. I had dedication, but I didn't have the ingenuity yet or the ability to think and answer the question. All I knew to just do something. Like going to a job. He didn't want an assembly line. He didn't want the Henry Ford assembly line. He wanted you, to every piece in that assembly line, to actually, like Carver would have done. He got so many products out of that peanut and sweet potato, right?
Mm-hmm.
That's what Dr. Harris wanted. He wanted something out of everything you did, and it needed to be meaningful, impactful, but not disruptive.
Well, that's awesome. So, Dr. Scott, this has been very illuminating, obviously, and I'm very sure that our audience is going to find it the same way. Thanks so much for sharing so much of your vision and your expertise. And to our listeners, thank you so much for joining us. Look out for more game changing conversations at the intersection of healthcare and innovation. So, Scott, I wish you have an awesome, amazing rest and a blessed rest of your day.
Thank you so much for having me. God
You're welcome.
bless.
Take care.
All right. Bye bye.